Good afternoon, and we are better together today. But let me just start off with some grim news, and then we'll get better as we go along. Today, the Houston Health Department is reporting 1,304 new cases of COVID-19. That's 1,304, bringing Houston's total to 45,415. Sadly, today, we're also adding 15 newly reported deaths to our count, bringing the city's total to 432. I'm not going to read each one. The list is on the TV monitors. 9 of the 15 are Hispanic, and the remaining 6 were Anglo or Black. And the youngest person was in their 40s, and 2 in their 50s with underlying health conditions. So as I stand here with Councilmember Carolyn Evans-Zabaz, Councilmember Cisneros, Councilmember Gallegos, these are just not the type of numbers that we want to report. Yesterday we reported 1,045 new cases. Today that number is 1,304, and 15 people who we are adding to the list who have died. In the month of July, to put it in some perspective, in the month of July alone, 200 people have died in the month of July alone. So of this 432 people who have died in the city of Houston, 200 of that 432 died in the month of July. And we still have 1 day to go. And so we're still moving in the wrong direction. The virus is still running rampant. And again, I'm calling on all Houstonians to come together and to do everything within our abilities to slow the progression of this virus. Not just to slow, because if you look at the numbers in the hospitals, the numbers has plateaued and things are starting to come down, the numbers in the hospitals. So when you look at the hospital numbers, the numbers are going in one direction. But when you look at the number representing the community spread, the number is still going in the opposite direction of what's happening in our hospitals. And as we know with this virus, what happens on the outside can be eventually, and what happens with the hospital numbers can still be somewhat of a lagging indicator. So we still need to get together and to put on these masks, sometimes two, to engage in social distancing, wear the face shields. Face shields is not the only protector, so you have to have the mask underneath, on, mask up, and then engage in the social distancing and exercise proper hygiene. And I know that Dr. Persse will have more to say on all of this. The COVID-19 virus is still hitting Houston hard. Our numbers are still too high, and while hospitalizations are going down, we're still in the worst part of the epidemic. As each of us needs to do our part. Thousands of our families and friends have been sickened, some with long-term health consequences, and hundreds of Houston lives have been cut short. The city of Houston's Hispanic community is disproportionately impacted, accounting for approximately 40% of cases and 45% of the deaths. And one of the biggest hurdles we face is getting factual, potentially life-saving information into the hands of the people who need that information the most. Today, with the Houston Health Department, we are launching Better Together. We are launching Better Together, a multilingual and data-driven public health education campaign, empowering Houstonians with the knowledge and skills to protect their families and communities with COVID-19. The campaign includes broad citywide messaging across TV, radio, print, digital, outdoor, and more. In fact, tomorrow, the Houston Health Department will have teams of workers spreading out across neighborhoods to place door hangers and talk to people, going door to door. And we will conduct more door-to-door neighborhood canvassing to provide testing information and education in high positivity communities and populations. In the age of social distancing, they will take all necessary precautions, but the public health crisis needs more direct communication with the public especially in neighborhoods that have been hit hardest by COVID-19. As we look at these numbers, and we see the rising numbers of cases, people testing positive, the number of deaths, especially in communities of color and especially in the Hispanic community, quite frankly, we have concluded that we have no choice but to go directly into the neighborhoods, go door to door to provide the information that people should be receiving. You may recall that earlier this month, the Houston Health Department launched an emergency outreach campaign for Hispanics. Todos Juntos Mejor engaged tens of thousands of Houstonians through a social media program that included more than 100,000 social media ads, all in Spanish. The educational efforts are not limited to social media platforms. Our health department targets outreach to the hardest hit communities identified by positivity, testing saturation, sewer sampling, and health vulnerability data. More than 71,000 flyers, 400,000 robocalls, and 71,000 text messages have already saturated these areas. And we have engaged community stakeholders, including faith-based groups, to amplify our message. This new campaign is not only about working together, it is about the 4 key actions working better together: wearing a mask, maintaining social distance, washing your hands, and getting tested. Better together is multilingual, multi-platform, and data-driven. And this campaign includes broad citywide messaging across TV, radio, print, digital, outdoor, and more. But perhaps most importantly, like Todos Juntos Mejor, the campaign is targeted to communities suffering the most through COVID-19. Better Together includes even more outreach that gets directly into the communities to teach prevention and shape healthy behavior. And at this point, let me pause, and if you'll turn your attention to the screen for 2 PSAs.
Houston, let's be better. And the only way we can do that is together. Let's be consistent about keeping a safe distance. Sanitize to save lives. Let's be beyond better about getting tested. This pandemic can only end if we are in this together.
Houston hay que hacer mejor y la única manera de hacerlo es juntos. Hay que ser consistentes en practicar distancia, desinfectarse para salvar vidas. Hay que ser mejor y hacernos la prueba. Esta pandemia solo puede terminar si trabajamos juntos.
We're better together, and at this point in time, let me call on Dr. Faith Foreman-Hays from the Houston Health Department.
Thank you, Mayor. The goal of Better Together is to empower Houstonians with the knowledge and skills to protect their families and community from COVID-19. In order to bring our positivity rate down, we must continue to go directly into communities. This means educating people in their homes, apartments, schools, parks, businesses, houses of worship, restaurants, and other places. To achieve this goal, the Houston Health Department will regularly deliver Better Together educational materials to key community locations with special focus in high positive communities. We will conduct door-to-door neighborhood canvassing to provide testing information and education in high positivity communities and populations. We will distribute Better Together education presentations and toolkits to businesses like restaurants, for example, and other community organizations. We will offer Better Together virtual town halls and community education sessions to groups like super neighborhoods, homeowners associations, management districts, and civic clubs. We will also live stream informational sessions and produce PSAs and videos like you've just seen in a variety of languages. And we will also place Better Together signage and banners in buildings or on buildings, roadways, and in public parks and libraries so that Houstonians are frequently reminded that the only way to beat COVID-19 is together. We know that we cannot do this alone, so we brought together a diverse group of community partners to help us saturate the city with the Better Together campaign. Our partners represent the diversity that we know is needed to help keep our community safe and to bring our numbers down.
Let me thank Dr. Faith Foreman-Hays from the Houston Health Department. Let me just say to you, our goal in August is to make progress in the fight against COVID-19. We must work together to lower the city's positivity rate, which right now is about 23%. Our goal is to get this rate down to around 5%, where the disease becomes more manageable and we're no longer chasing the virus. So that's the goal. I'm asking Houston, the month of August. This is the month when we turn this around, not just in our hospitals, but we return this virus, we turn it around in our communities. And if we work together, better together, if we work together, then in the month of August, 30 days from now, then I believe we'll see a noticeable improvement in the communities in our city, if not sooner. But it's going to take us all to be very intentional in getting it done. So let me pause now and bring up Dr. Persse.
Thank you, Mayor. I'm going to be brief. I just want to remind folks that at our testing centers, we've actually seen a decrease in the number of folks who are going and getting tested. And would like to encourage folks to go and get tested. The line should be short because of the decrease, and that's a great asset that's available. It's not being capitalized on as much as it was, and we really need folks to go ahead and take advantage of that. So call the health department, and we will get you your appointment, get you your authorization code, and get you tested.
And let me emphasize that again, and that is we're expanding our testing sites throughout the city of Houston. We're encouraging people to go and get tested. We've noticed the numbers start to decrease a little bit, but quite frankly, the testing becomes a vital tool to getting control over this virus. So please, let me encourage you to go take advantage of all of the testing sites throughout the city of Houston. And for the city of Houston, with regards to the city of Houston testing sites, those sites are free. Let me emphasize, those sites are free, and we do not ask for documentation. It doesn't matter who you are, it doesn't matter whether you're documented, undocumented, that simply does not factor in. So please take advantage of all of the testing sites in the city of Houston, and the city of Houston public testing sites, those sites are free. Let me call on now Chief Pena with the Houston Fire Department.
Thank you, Mayor. Good afternoon, everyone. So first of all, I'd like to thank the community of the city of Houston for the support that they gave the Houston Fire Department and the Lucio family. This week, we laid Captain Leroy Lucio to rest in his hometown of San Antonio. And again, appreciate the calls for support, the prayers. Appreciate the San Antonio Fire Department and Chief Hood for their support, their incredible support in helping us properly honor our fallen firefighter. Today, the numbers for the Houston Fire Department in regards to quarantine are looking a lot better. We're at 136 firefighters in quarantine. We have 29 firefighters that are currently positive with coronavirus, and we have one of those firefighters that is in the hospital in ICU. Again, I want to renew my call for prayers for veteran firefighter Pacheco, who is in ICU. We're hoping for a full recovery. We're going to give him all the support that he needs, but we need the community support as well. In regards to our occupancy task force, we had 9 complaints that we responded to in the last 24 hours. There were no citations issued in the last 24 hours. All the complaints were resolved voluntarily, and we got into compliance before we left that establishment. That is my report for now.
Thanks, Chief Pena.